bills that are gonna go by. Senate Bill 185, Senator Donovan is gonna go by for the week. Senate Bill 568, Senator Donovan is gonna go by for the week. Senate Bill 738, Senator Deeds is gonna go by for the week. Senate Bill 739, Senator Deeds is gonna go by for the week. Everything else is fair game. And we're gonna start out by toying with Senator Mason's number 572.
I like it. Let the toying begin, Mr. Chairman. Thank you very much. So this bill is brought to me by the Alzheimer's Association, and as we know, this is a disease with no treatment, no cure, and yet we anticipate the number of people having it tripling by 2050. And we also think that today, like 1 in every 4 hospitalization treatments for it could have been avoided with just awareness, a plan. There's even some indication, they tell me that there's studies that are saying there are ways that there's some prevention opportunities out there. So this just lays out, and it's building off a federal situation. The federal government passed a bill called BOLD, Building Our Largest Dementia Infrastructure. And they allocated about $10 million to be used through the CDC to try to accentuate efforts like that.
If we can allocate that money.
Yes, sir. And then we expect RFP to go out in 6 to 9 months. This will put Virginia out front, and you see the things: educating the public, early detection, reducing risk of potential hospitalization, reduce risk of cognitive decline, and supporting care planning and management. So it's really just an effort to try to help us get out front of this, be aware of it, and see if we can draw down some federal funds to put things in place.
All right. Is there anybody here speaking in favor of Senate Bill 572?
I'm Carter Harrison with the Alzheimer's Association. I'm happy to answer any questions. Senator Mason did a great job.
Anybody else in favor? Could there possibly be anybody opposed to this bill? That would be pretty hard. Okay. Questions from the committee? Second. Motion is to report, duly seconded. All in favor say aye.
Aye.
Opposed, no. She gone.
Trying to help you ease in, Mr. Chairman. Thank you all very much.
You should have been here instead of cerebral this morning.
Yeah, well, I like following Sarah.
All right. Let's see, what else do we have? I don't think we have anybody here that's not on the sub. So Senator Dunn, why don't you go ahead and take a crack at yours?
I'm gonna go there or stay there? Very good. Okay, thank you, Mr. Chairman. I will start with the easy one. We'll go to 569, and this is the app that we've talked about before. This says pass the Senate 40-0, and it is basically an app that would allow to have easy access to 24/7 mental health services in the state of Virginia. This is a service that's already provided but not connected in an easy access. It's currently the 1-800 number. And it would also allow for a uniform reporting of a threat. And what this basically does is it allows the forensics, the Fusion Center down at the state police to set up a centralized reporting location that can interconnect with all law enforcement and other services across the state of Virginia, so that if there is a threat, people know where to report it and they know how it will get processed. So basically, this is an attempt to make sure that we have easy access in a more modern way for these two services in the state of Virginia. There is a little bit of an amendment that's going to come between now and the committee. Across the country, there has been a lot of attention given to a panic button. Oh, we have the amendment already ready. Thank you so much.
Would you like
to
to read it?
Yes, thank you.
Mr. Chairman, on line 33, after concerns, period, insert, the public safety mobile application shall include a panic button and an active shooter button.
So moved.
Second.
All in favor of the amendment? Aye.
Aye.
Okay.
So, Mr. Chairman, this just allows the fusion centers, they develop the app, to add those two additional applications which have been received with a lot of popularity. It basically gives a panic button for teachers in the schools. It would be a restricted app, or an actual active shooter to make the fastest reporting to 911 possible through these apps and its functions. The app isn't developed. It would be an app that we developed for all of Virginia, and we would give the Fusion Center the ability to develop that as they saw fit. But that is the bill, Mr. Chairman.
Is there anybody here who wants to speak in favor of Senate Bill 569? Anybody opposed? This is another mom and apple pie bill, so nobody's opposed. Okay, questions from the committee? All right,
Move to recommend report. Second.
moved and seconded that we report Senate Bill 569. All in favor say aye.
Aye.
Opposed? All right, next.
Thank you, Mr. Chairman. Senate Bill 365 is an attempt to reduce the cost of healthcare by working through the administrative side and some of the hurdles that are so difficult. Healthcare has evolved significantly in that there are a lot of hospitalist programs that provide care, and they require a robust staff of hospitalists doing shift work. And the result is that there's a little bit more mobility. Physicians don't go necessarily to a location and stay for 20 years. They may be more mobile with their services. And basically what we're trying to do is make the credentialing process less difficult. We definitely want it to be rigorous. We want to make sure that anybody that is providing care to Virginians is fully qualified, who they say they are, and that they have achieved the education and training benchmarks that we expect them to have treated, and that they don't have any reports elsewhere in other states that we're concerned about. But we don't have to duplicate that process 5 and 10 times. And that's the intent of this bill. For when you're credentialing for medical services, we are, the hospital is, to receive privileges at the hospital is usually the first threshold that you have to cross in order to practice. Not all physicians actually credential at a hospital anymore. A lot of primary care providers and pediatricians don't have hospital services, so this would not relate to them. But for anybody that has to credential through a hospital, they have to provide primary source references. That basically means my medical school, every job where I worked, has to send directly from that primary source the information to the person who is accumulating the data and verifying that it's accurate. If we had blockchain, Mr. Chairman, this would not be a problem because you'd be able to verify primary source once. But we need to do this every time we go and get credentialed at a new hospital. Once you're credentialed at a hospital, and that usually takes somewhere between 90 and 180 days, that verifies that you can take care of patients in that hospital. That does not mean that you can bill for your services with the health plans. The health plans have a responsibility to do due diligence to make sure the people that they're paying for medical services are likewise appropriately credentialed and prepared. But for the physician, for the practice, they have to duplicate that process again and again and again and wait up to 90 days or more with each of the health plans. And so, Mr. Chairman, the attempt of this bill is to say, look, when rigorous due diligence has been done by a hospital to credential a physician to provide services at that hospital, that meets the criteria to fulfill the expectations of the health plans, and that one process should be able to serve as due diligence for the health plans. And a review with the Bureau of Insurance and where the regulations stand now, that is a change that we can make. The language in Virginia is very obscure about what the responsibility is. It's basically just an adequate process that's required. And so this bill proposes that for physicians that are credentialed through a hospital to provide services, that primary source referencing will suffice for the health plans.
All right, is there anyone to speak in favor of Senate Bill 365?
Mr. Chairman, members of the committee, Brent Rawlings, Virginia Hospital Healthcare Association, reached out to Senator Bennett and expressed our support for the legislation in general. We see some challenges with credentialing, and streamlining that to the extent possible is certainly would be helpful for our operations.
Anybody else in favor of 365? Opposed to 365?
These are copies of the regs, there's 5 copies there, that are part of the reasonable process that VDH requires of us by statute. Statute requires us to have a process, the health plans under 32.1, 137.1, and 137.2. The rules are long, there's 4 pages of them, and they're very specific, and they're supposed to have been rewritten, and they have not been. And we have a representative here from VDH, which is Eric, who can kind of explain the status of the challenge with that. Every organization who's a health plan has to do original source verification. we are required by contract from Medicaid to be NCQA accredited and meet their standard. Their standard is in essence adopted in those regs. And so that is the standard of the day for us. Every health plan has to do it on the commercial side as well. We don't know what the standards of the hospitals are, or whether they meet ours or not. The senator is right that people end up having to get credentialed in multiple places. And it would be great if we had one piece of data that was reliable for everyone so that you could do it once. I mean, that would be great. But that would involve making sure that everybody's questions were answered and that it could be kind of certified that way. So that would include practices. There's large practices that have to credential. Then there are also hospitals, and then there are also health plans. The other challenge with this is the way this language reads. I think if you're an employee of the hospital, often the contract includes allowing the hospital's credential to do the credentialing for the plan. If you are not under contract with the plan and you're working at a hospital, you are not part of that arrangement. And so one of the challenges with the hospitalists is if they're not under contract with the plan, then there isn't a back office to rely upon in the arrangement. If they're employees, there would be. And so the real question for this bill is, are you trying to do just folks who are employees, or are you trying to do folks who just have privileges there? Folks who have privileges there don't have contracts. And for us, that makes all the difference in the world because we don't have a relationship with them. Credentialing is a precursor to and part of contracting, but they're two separate things. And you have to have the credential to be contracted. So we're not adverse to working on the idea of trying to figure out how to do this better, but I'm not sure that this really helps in the sense that we would, within 14 days, regardless of the standards of the hospital, have to designate them as credentialed, even if they do or do not meet our standard. And the problem for that is we have obligations to others. And that's why we have one standard and try to meet it. So that's kind of the challenge with it. Eric can kind of tell you the history of what it is they do in regard to our license. We have an MCHIP license at DDH, which is what they administer, and this is a requirement of getting a DDH license. So the statute says the reasonable procedures will have to be in the application, but then the regs say, here's the 4 pages of stuff that you have to do. So this is a serious policy issue. I mean, we don't want people out treating folks who are not credentialed.
So
That's what we're trying to avoid.
Let me ask you this. So what you handed us is the regulatory protocol for health plan credentialing. That's what you're regulatorily required.
It's the regs, and the guy who can explain that is Eric.
Well, and I don't want to get too deep into that, but I just want to know, and I guess I should have asked Senator Donovan this. Do the hospitals have a regulatory provided scheme of credentialing, just like the health plans do?
Mr. Chairman, as far as the state regulations, I don't believe that there is a specific regulation as specific as what the health plans have in terms of all of the different criteria. We are regulated by Medicare, CMS, Medicare, Medicaid Services, federal agency. We also have accreditation, and all of those bodies have some pretty specific credentialing requirements that apply.
So wouldn't that be problematic if this bill is asking them to rely upon the hospital's credentialing?
Well, I think that's something that I can't speak necessarily to the regulations, but I would be surprised if there is wide variation between the two. To Doug's point, I think there's certainly areas where we could converse about those and find a way to streamline that so it does ease the process.
Mr. Chairman?
Yes.
If I may, this bill works to have these regs rewritten. And I think we've just heard from Mr. Gray that there is a process for an employed physician to have an easy transition to credentialing through the health plans. The only difference I think that there is, it's the same process at the Department of Physician Services at each hospital. So if they already have this in place for employed physicians, it's an easy leap to align non-employed physicians This is a requirement, adequate credentialing in order to be approved by the health plan to bill the health plan. So they would still have the process of either following up for more detail if they needed it, but to set general guidelines where this is aligned with best practices that are already happening between the hospitals. This costs about $3,000 to $6,000 a year for credentialing for every doctor. And if you have doctors moving in and out, you have an enormous cost in healthcare that is unnecessary duplication to establish safety for patients. It's an opportunity right when the Department of Health is about to rewrite these regs, to rewrite them in a way. This it's the only prescriptive part is that there's a time limit which can be discussed on how long they have between one and the other. But this would solve a lot of our problems in retroactive billing. This would serve a lot of problems in access to providers because providers can get up and running. But to draw this process out for a year or more to get through all the thresholds for the hospital and then the health plans, it just doesn't make good sense. We have an opportunity to redo regs to fix it.
Anybody else want to speak to 365? Anybody else? Members of the committee, questions? No questions? No one else to speak? Looks like we're ready for some action, if any, on the bill.
Mr. Chairman, I would just remind you that credentialing is not contracting. And it will not help with people who are not going to contract with the plan. So it doesn't address that part of the situation. The reason people don't have to go through credentialing that are working for as an employee for the hospital is that's part of the contract with the hospital, that the hospital takes responsibility for it. And it takes just as long for them to credential as it does for us. And so we can do that in instances where they're an employee. We can't with people who are just getting privileges. It's a different arrangement. They cannot bill us until there's a contract.
Senator Donovan?
Yes, Mr. Chairman, just to clarify, these are physicians in most cases. I think the time that there would ever be a physician that came to practice at a hospital that was not entering a group that already had a contract with the health plans. The contract may not be conveniently co-located with the hospital as an employed physician, but if they're joining a hospitalist group, those groups already have contracts with the health plans. And so there is a small bridge that needs to be built between a practice that has a contract with health plans that hires a physician that is credentialed through the hospital, and a hospital that hires an employed physician that has a built-in contract. This isn't apples and oranges, it's just a little bridge we need to build.
And it's not a little bridge. There
Senator
needs
Sutherland?
more
I thought
work.
we're at the portion for the committee to
Well-
speak on it.
Okay, well, a little dialogue in the subcommittee is not gonna hurt anything. But the moment we've all waited for, certainly I've waited for, Senator Barker.
Thank you, I think. So, I do have some personal experience in this issue. I was director of a community health center for a good while, and we had challenges in terms of getting credentialing done for the providers that we had. We had dentists, behavioral health professionals, physicians, and nurse practitioners, et cetera, a whole wide variety of things. What I can tell you is that there clearly, in my dealings with things, there clearly were times where it took a lot longer than it seemed reasonable to get it done. But also that us putting together the information to be able to do our own internal process at the health center, also it took a long time in many instances for the individuals to be able to get all the information to us to move forward. And so I think I think it's probably the best approach probably moving forward is to work out something where we have the discussions that get everybody on the same page. I think 14 days is probably too short, but I'm not quite sure what the right number is right now, and I would not want to put it too long out there either. So I think that we need to try to address this issue. It is a significant issue, and certainly part of what we encountered with the health center sometimes was when we were able to hire someone, we didn't wanna lose them by waiting until they got credentialed, so therefore we would go ahead and hire them. And yet in many instances, they were not able to provide services to our insured patients, or at least some of the insured patients. And, you know, there are different mechanisms to help move the process along. The Federally Qualified Health Centers in Virginia have an entity that does its own, you know, does credentialing and works with all the health centers, so that you have standard criteria that are provided across the board, and nobody's sort of gaming the system there. And part of what we were able to negotiate with at least a fair number of the plans was that once that independent entity, which was not part of the health center, either staff or board, took the action on it, that they would act very quickly. So I think there are a lot of ways in which these types of issues can be addressed. And I think it's good, we're gonna try to tackle it, but I'm not quite sure that 14 days is where we need to be to get that done.
And I'm amenable to discussing that timetable or leaving it up to the Department of Health, quite frankly.
I'm glad we heard from the other committee member.
So
Would you like a motion?
That's how we move around.
I'd like to recommend, or move that the subcommittee recommend the full committee report to the bill.
Second.
Okay, we have a motion, we have a second. All in favor of reporting, 365, say aye.
Aye.
Opposed, nay? Nay. Tie, motion fails.
Yeah, the motion fails, but we can still go to full committee, so.
Yeah, there's no recommendation. Okay.
Is that you?
Senator Boyce, go. You're up.
It's old enough that you can switch them out, or do you just put another one on?
I don't know, it's like an external battery.
Oh, okay.
Yeah.
Makes sense.
Must be charged then.
We can set that up. All right, well, let's get your substitute adopted first. All right, everybody take your gander at the substitute, so we can get this bill in the form where we can consider it. Well, let's go ahead and adopt the substitute. I'll move the substitute be adopted.
Second.
And seconded, all in favor of adopting the substitute, say aye. Aye. Substitutes before us, then you got a line amendment for the substitute.
I do, yes.
The clerk report, or somebody report the line amendment if they have it, or do you just have it?
I just have it, it's
Okay.
on line 32. Strike the word affidavit, and add on, submit a form furnished by the state registrar. Okay.
All right, I'll move that amendment. Senator Barker will second that amendment. All in favor of that amendment, say aye. Aye. The amended substitute is before us. So tell us what your amended substitute 657 does, Senator Borsco.
Sure, the amended substitute eliminates the requirement that a person provide a court order indicating that their sex has been changed by a medical procedure to receive a new birth certificate here in Virginia. It allows this new birth certificate to be substituted for the original certificate of birth to reflect a sex change, a change of sex. We already have a procedure, I don't know if you all know this, we already have a procedure in place for transgender individuals to go through to change the sex listed on their birth certificates. This would eliminate the existing requirement that they must present a court-ordered proof of a medical procedure. It is inconsistent with the medical understanding of gender identity, and the advocates believe it's an invasion of privacy. The burdensome requirement of providing a medical procedure not only violates an individual's privacy and autonomy, but also has a disproportionate socioeconomic repercussions Surgery is expensive, it's not always covered by insurance, it's not widely available, and requires a long and painful recovery period. And this would allow them to have consistent IDs so that they can open their bank account, start a new job, enroll in school, travel, or other routine processes. All that's required for a transgender person to have their Virginia driver's license, social security records, or US passport reflect their true gender is a letter from the doctor confirming that a person has gone through appropriate gender transition related clinical care. This would align it with those requirements. And it requires an individual to show evidence that they have received clinical appropriate treatment, but does not require medical procedure. So I have people here from the Office of Vital Records. I have people here from Quality Virginia who can answer any questions that you all may have.
Let's see, anybody want to speak in favor of 657 substitute as amended?
My name is Caitlin O'Brien. I'm a transgender woman working currently at Newport News Shipbuilding in Tidewater, Virginia. And yeah, I am a transgender woman. I've been through processes and I'm familiar with also the modern medical understanding from organizations like the American Medical Association, the American Psychological Association. This is to make it so that I can access employment. This is so that I can access healthcare, so I can be functional as a citizen. I can open a bank account. If I can't show documents that are consistent with how I appear, then who's to say that I'm the person that I say I am? This is in accordance with where modern medicine has been going for a while, and I would like to ask that it be updated so that people like me, people that I know in my community, can access the things that we need just to get by day-to-day life.
All right, anybody else?
Chairman Lewis, members of the subcommittee, my name is Dee Lamnick. I'm the Executive Director of Quality Virginia. I would ask you to support this bill today. As Caitlin was saying, it's really important for individuals in the transgender community to have their identity documents match. And right now, the Department of Motor Vehicles has a process in place to streamline that process, and so this would follow in a very similar process for that. Right now, about 2 in 3 transgender people actually report that their identity documents do not match, and as Caitlin stated, this makes it very difficult when applying for jobs, when applying for a house, when opening up a bank account, for example, and so making sure that your identity documents match helps you facilitate that process. Every person should have access to identity documents that accurately reflect who they are so they can live and work in the Commonwealth without experiencing discrimination. Thank you so much for your support of this bill.
Okay. Anybody in opposition to 657?
Good afternoon, actually. Mr. Chairman, my name is Dr. Todd Gatkin with the Family Foundation of Virginia. On behalf of the Virginia families, we strongly oppose this bill. A birth certificate serves as basic proof of age, citizenship status, biological sex, and who your parents are. And it's important to recognize that birth certificate designates the sex objectively recognized at birth. It's immutable, it's scientific. And as the patron mentioned, under current law, in order to change the sex on a birth certificate, one must obtain a court order that declares the individual has undergone the necessary medical procedure. The bill eliminates the requirement and replaces it now with a form. Of course, in addition to that, the bill doesn't identify what clinically appropriate treatment is either. Note also that under this bill, a person would have to have a court order to have a name change, but not his or her sex. There is also no limitation on the number of times or frequency that a person can change their sex on their birth certificate. This only adds to the societal chaos and creates a serious problem for the Department of Vital Statistics. This is a critically important document. It's necessary, as we've mentioned, to obtain a social security number, apply for a passport,
enroll in schools, get a driver's license. To allow a change of sex designation on a birth certificate by simple request can lead to numerous security concerns and much chaos. Consider a male sex offender who has his birth certificate changed and would be required to be housed with female inmates. Or a biological male who demands entrance into a women's shelter. This happened in Alaska, and it was later found out that that male was also a sexual predator. Perhaps the most glaring issue that our society is grappling with on this topic is males participating in female sports. There are clear physiological differences that give males an advantage in sports, and allow them to compete. In Connecticut, we know of 3 female track athletes who have filed a Title IX complaint with the U.S. Education Department's Office for Civil Rights because 2 males are competing on a rival female track team. In fact, the 2 males competed in a male track meet just 2 weeks prior to competing against the females. And in just 2 years, those males had managed to rack up about 17 state titles. Regarding the use of female changing facilities, the threats to female privacy are real. In Hanover, Virginia, a young boy recently went to another state to have his birth certificate changed after the state passed a similar law and is now using the birth certificate to access girls' locker rooms. Female classmates are feeling violated. These are just some of the outcomes, but we could expect more if this bill were to be passed. And the dramatic shift in sex change recognition as proposed in this bill would no doubt lead to endless complications. We respectfully ask that you oppose this bill.
Next.
Mr. Chairman, Tom Torcio with the Virginia Catholic Conference members. The Virginia Catholic Conference opposes this bill. We believe, of course, that a birth certificate has always, traditionally has always been a historical document to indicate information about a natural person, of course, and identity information about them, where they're born, their sex. Obviously, it's a factual document. It's an important historical record. And as we know that, has been mentioned, the code already does provide an exception for individuals that would like to change their sex, and that's currently in the law. It was an exception that was inserted, and it's on the second side of the bill. If you have the numbered version, and it's there down 101. It's been crossed out there. So that's the existing one, and that at least that standard is of course based upon where a person can demonstrate that they've had a surgical has undergone surgery to affect the change in sex. So that's at least an objective standard, even though it's a departure from the historical thrust of what we're talking about here. At least it is an objective standard. This proposal, by contrast, introduces a subjective standard, and the reason being is if you go down to lines 48 and 49, there in italics it says requirements related to obtaining a new certificate of birth to show a change of sex may include a requirement that the person requesting the new certificate of birth submit, and so we have the substitute version now, which is a form furnished by the state registrar as opposed to an affidavit. That's actually that could be interpreted as a more subjective standard than the affidavit itself. The affidavit at least is a legal document that's commonly used in court. So this change introduces ambiguity and some uncertainty in the law, and we certainly don't, we would submit that that's not a good change to make for precedent purposes. So with that being said, We would just, like to urge that, especially, I just wanna hone in on that last point there, that I think I wanted to mention 52, line 52, it shows, to show a change of sex, it's 51, that the person has undergone clinically appropriate treatment for the purpose of gender transition. That's a key sentence there, because it says, has undergone clinically appropriate treatment for the purpose of gender transition. So that's actually a provisional phrasing or language. It's provisional language because it doesn't constitute affecting a change in sex, which the current law does. This is provisional and certainly could lead to a lot of confusion as to at what point is the change affected. So for example, would that be hormonal treatment? Would that be counseling? There's a lot of variance in that language. So with that being said, we would just ask the committee to respectfully preserve the existing exception and maintain the clarity that provides. Thank you.
Next.
Yes, if I, Mr. Chairman and members of the board, if I may speak.
Go ahead and identify yourself first.
Yes, my name is Dr. Sarah Fox. I am not only transgender, I am a transsexual. I transitioned 25 years ago. I had surgery 20 years ago. And as I said, I am a neurobiologist as well. And so I'm legally female. I've been through this whole ringer. I'm here to tell you my experience with the transgender community. I've heard a few points brought up that I would just like to try and dispel because I believe they're myth. The notion of how often a person may want to change their gender. I have known hundreds, at least, of transgender individuals. I've never, ever known a person to change their gender marker on their identification more than once, ever. Nobody would want to. It's not a minor thing you do. You're throwing away your civil rights. You're endangering yourself. You're exposing yourself to employment discrimination. This is not something you do on a lark. It's not something you do to assault women or to compete in athletics. This is something you do because this is how you need to lead your life. Also, I frequently hear references to science and the science of biological sex and all that. And as a scientist and as a biologist and a neurobiologist at that, I hope you'll listen to me when I tell you that there is no simple biological definition of sex. So if you consider me, I'm the way I am. I'm not saying I'm the only person who I'm not saying everybody got this place the same way I have, but in my own case, I got where I am because of serious hormonal disruptions in the uterine environment during gestation. So my mom was on a drug called diethylstilbestrol in her 3rd trimester of pregnancy, and it resulted not in the failure of my genitalia to develop according to my chromosomal makeup, but the failure of my brain to masculinize. And so it became the default gender of female. There are so many axes of gender, of sex in the human body. Every single organ in your body is either female or male or some mixture in between. And for most of us, there's no problem. It all ticks down the line and we come out perfect. But for some of us, we come out a mixture of traits. so this is who we are internally. This is how we live in our head. This is where it's important to us, not here. This doesn't matter. And trust me, when you go on hormones, really nothing else matters. So, you know, when people transition, they need the necessary documentation so they can go on and live their lives. And it's as simple as that. So, that's all I have to say.
Thank you. Senator Bushman, I think you wanted to add something.
Yeah, I would just like to respond to the gentleman who was talking about the need for the medical, documentation that you've had the surgery. This bill is just gonna make it consistent with other forms of identification. Other major documents do not require this step for gender changes. Your passport, your social security number, your driver's license. Passports, June 2010, the State Department announced a policy to issue passports reflecting a person's current gender. Under this policy, a transgender person can obtain a passport reflecting their current gender by submitting certification from a physician confirming that they have had appropriate clinical treatment for gender transition. No specific treatment is required. The policy replaces the department's old policy, which required documentation of sex reassignment surgery. Social Security. A transgender person can change their gender on their Social Security card records by submitting either government-issued documentation, which is what we are suggesting here by having the Department of Records provide a form, which would be an official government state record, or from a certification from a physician confirming that they have had an appropriate clinical treatment from a gender transition. Our state driver's license here in the Commonwealth update the name or gender identity on a Virginia ID. The applicant must submit an application for a new ID, and they use a court order certifying the name change, if applicable, and or a gender designation change request signed by a physician, a psychiatrist, a nurse practitioner, clinical social worker, a psychologist, or professional counselor certifying the applicant's gender identity. The purpose of this bill is to bring us into conformity with other major identification forms so that a person can have a consistent record of identity throughout all of their forms, so that they can carry on with their lives.
And is it my understanding that under the current scheme, in this code section, that you just get an amended certificate, right? And your bill provides for a.
This would give you a new one, so they would be able to live their lives as they are.
All right, questions from the committee?
Mr. Chairman, I have some questions.
Yeah, Senator Donovan.
I'm listening to the articles you just read, and I'm looking at this, and I don't know why we don't include in here a letter from a medical professional that, they have, I mean, I understand why you wanna say appropriate treatment for gender transition, but by crossing out, I mean, affidavit you may not want, but, you know, all those other, documents included notation, and I will say that the standard of care for transition is rigorous. And, so a statement from a health care provider would be a valuable addition.
And that is in the bill on line 32.
I thought you struck affidavit provided by a healthcare provider.
Only affidavit, that was the only word, so I added
misunderstood.
to make it, just make sure that we're using a standard, I think, put in, submitted a form furnished by the state registrar, provided by a healthcare provider from whom the person has received treatment, stating that the person has undergone clinically appropriate treatment for the purpose of gender transition. Requirements related to obtaining a new certificate of birth to show a sex change shall not include a requirement for the evidence of the medical procedure. Does that help?
It does, let me just clarify, it says, submit a form from the state registrar and a form from?
Provided by the health, so the form would come from the state registrar, but the doctor would fill it out.
Got it.
Is that
helps
clear
me.
enough?
Yes. And then may I just suggest friendly amendments
Sure.
that on line 34, the purpose of, I just don't think that you need that. I think it's a clinically appropriate treatment for gender transition. That doesn't require surgery.
Which line are you on now?
34. And I just will say, I think that, let's one look at mine. I would, this may be gender transition period. What's not included in this is stated in what is included.
Okay.
And so I think you can strike requirements to the end of medical procedure.
We got 2 amendments in, or you wanna do it as one? Two separate amendments,
Would
okay.
you like me to read them?
Yes,
Just
that would
to
be
clarify
helpful.
that we're all.
Amendment number 1.
Alright, Mr. Chairman, on line 32 of the substitute, we're gonna strike an affidavit provided and insert a form furnished by the state registrar completed, and then it'll continue to read by a healthcare provider. On line 34, we will strike the purpose.
For the purpose.
No, just, treatment for gender transition, so strike the purpose of.
Strike the purpose.
The purpose of.
The purpose of.
The third one is the deletion of the sentence following gender transition. You could do all that as a just one, that.
Okay, we can do it as one. And then we'll strike on line 34, requirements through procedure on line 36.
So, and I'm gonna ask you all, Mr. Chairman and members, do you feel like it would be clear enough to set, that does not require, I think the advocates probably wanna make certain that they know that you don't have to go through the reassignment surgery, do you?
I think when you say appropriate treatment for gender transition, that is a clinical designation and it may or may not include surgery.
Okay, I just wanna make certain of it, okay.
I think.
But it's a rigorous clinical threshold.
I'll second those 2 or 3 amendments, whichever they were.
All right, motion seconded by Senator Parker. All in favor of the amendment, say aye.
Aye.
Opposed? Okay, the amendments have been adopted. The amendments to the substitute have been adopted. Anything else? Any other questions? Oh, you got more? Okay.
I'll make a motion to, recommend to the full committee the, approval of this.
Substitute as amended.
Substitute as amended.
And I second that motion. All in favor, say aye.
Aye.
Opposed?
No.
1 no. So the recommendation to the full committee is that the bill be reported. Thank you, Senator Warsko. Committee subcommittee adjourned. Thank you all.